Hi students, welcome to Chapter 10. In this chapter we're going to be discussing different substance use disorders. In this first segment we are going to be focusing in on alcohol use. As usual, we always start off any new unit or module talking about the learning objectives, the things that you need to be able to accomplish or that you need to be able to do by the end of the chapter. By the end of this chapter, students need to be able to describe the epidemiology and symptoms of drug and alcohol abuse and dependence. We're going to be reviewing, and you as a student need to understand the major etiological factors for substance use disorders. We're going to be talking about genetic factors, some different neurobiological factors, mood and expectancy effects, and some different sociocultural factors. We are going to be spending some time talking about some of the different approaches to treating substance-related disorders. And finally, at the end, we are going to be talking about some of the different approaches to prevention. So in this table here, what we're looking at are some data that is produced by the Substance Abuse and Mental Health Services Administration. It was a big study done that basically asks individuals over the age of 12 if they have used drugs or alcohol within the past 12 months. Alcohol, as you can see, remains the most common used substance with 135 million Americans, about 135 million Americans reporting alcohol use of some kind. In addition to that, we see about 59.7 million Americans reporting at least one episode of binge drinking. We're going to be talking about binge drinking in a little bit more detail, but when I use that term binge drinking, I want you to understand that I'm really referring to drinking 5 or more drinks in a short period of time. Cigarettes are also very common. About 22% of the population have reported using cigarettes within the past 12 months. In terms of illegal or illicit drugs, marijuana is the most common. About 7.3% of the population reported that they had engaged in the use of marijuana within the past 12 months. That works out to be about 19 million people reporting having used marijuana. In this chapter, we're going to be talking about all these different forms of substances, both alcohol and different drugs, and the abuse and dependence of those drugs. So originally, when we talked about substance use disorders, the DSM divided that into two categories, which was substance abuse and substance dependence. Considering the widespread use of drugs and alcohol within our society, there needed to be some work done to revamp and reevaluate this category within the DSM. And so the DSM reorganized, and now it only has one category. That category is called substance use disorder. When it was split up into two different categories, we had a lot of problems with reliability. Having practitioners, different clinicians, be able to consistently differentiate between these two categories and apply them correctly to clients. So now we have one category, which is substance use disorder, and then we specify that by the substance that the individual is abusing, whether that be alcohol, amphetamines, cocaine. One of the things that I do want to point out is the addition of gambling. This is new to the DSM-5. This is a new addition to our conceptualization of the relationship a person can have with gambling, and thinking about it as an addiction. So what are some of the criteria? What are some of the criteria that the DSM has listed for substance use disorder? In 2012, there were about 27 million people who met the criteria for a substance use disorder. The symptoms are going to include things like failure to meet obligations, repeated use in situations where it may be physically dangerous, relationship problems, also things like spending a lot of time trying to obtain the substance, various activities simply being given up or reduced, and continuing to use despite knowing problems caused by the substance. There are two things that I want to point out here that we're going to be spending a little bit more time talking about, which are these ideas of tolerance and withdrawal. And these are two major symptoms that we look for when we try to consider whether or not an individual is addicted. So with the change also came the idea of including severity ratings. So an individual would be considered mild if they only met 2 to 3 of the criteria, but severe if they met 6 or more of the criteria that we had listed in the earlier slide. When we use that term addiction, what we're really talking about is a severe substance use disorder. So again, that individual has met 6 or more of the criteria that were outlined in slide 5. Having 6 more severe symptoms such as tolerance and withdrawal. And remember, I told you before, we're going to spend a couple minutes talking about tolerance and withdrawal. It's important that you understand what those are and are able to tell the difference between them. Tolerance basically tells us that as time has gone on, the individual needs larger doses. The lower dose doesn't produce the same effect. They've become tolerant to the substance, whether that be alcohol, whether that be cigarettes, whether that be cocaine, and they need more and more in order to get the desired effect. Withdrawal is the negative physical and psychological effects from stopping the usage. So if the person doesn't get the dose that they need, that they have now become dependent on, what happens is they start to have symptoms of withdrawal. They start to feel physically ill, psychologically ill. When we're considering addiction, we often find that tolerance and withdrawal are connected to addiction, and what that results in is using more than intended amounts. That the person often ends up drinking more than they had intended or using more drugs than they had intended, and they have a lot of difficulty in stopping. They often try very unsuccessfully to stop. Any other issues that they might be having, whether they be physical or psychological, those are made worse by their drug use, and they have a lot of problematic relationships. We're going to focus in or start off our discussion on substance use disorder by looking at alcohol first, primarily because of it being so common within our society and the high levels of use that cut across our society. When we use the term alcoholic, what we're referring to is an individual that is physiologically dependent or a heavy user. If that individual is attempting an abrupt withdrawal of alcohol, this idea of getting clean or going cold turkey, it can be very dramatic. Detox for heavy users is really done best within a hospital or clinical setting because they can experience delirium tremens, DTs. This happens when blood alcohol levels drop suddenly. They can become delirious. They may hallucinate. They can be both visual hallucinations and tactile hallucinations. A very typical hallucination that happens with DTs is this idea that that bugs or roaches are crawling on them or crawling all over their room, and they become very agitated and anxious about that. And so detoxing from alcohol for a person who is alcoholic or a very heavy user of alcohol, very dependent on alcohol, really is best done in a clinical setting. We do see a fairly high level of comorbidity with alcohol use disorder and the use of other drugs, especially cigarettes. And we call that polydrug abuse. Many users of alcohol abuse multiple substances. So cigarettes, cocaine, marijuana. About 85% of alcohol abusers are smokers. We don't really know why that is. We speculate the reason is that the consumption of both alcohol and the nicotine that is in cigarettes maintains the brain's dopamine pathways associated with reward, and we're going to talk about that in a little bit more detail. But we do see that those two drugs have a tendency to go hand in hand. So students, I talked a little bit about the fact that we're going to start off with alcohol because of its prevalence. And the prevalence of alcohol abuse is by far the most typical substance that is abused in the United States. If we look at it from a lifetime prevalence, we see alcohol dependence or abuse at about 8.5%. About 8.5%. Even though we have seen a decline from previous years, drinking is a problem. Particularly binge drinking is a serious problem, and this is a serious problem among college students. Now, I've already mentioned binge drinking. We define binge drinking as 5 drinks in a short period of time, within an hour, maybe even 2 hours, but drinking several drinks in a very short period of time. And we see an almost 40% prevalence among college students. When we think about heavy use drinking, this is 5 drinks, 5 more times in a 30-day period. And we see about a 13%, 12.7% prevalence among college students. Even though the rates have declined from previous years, it's still a very serious issue. About 1,800 college students die each year from alcohol-related incidents. This includes not just dying from drinking too much, but violence that can be associated with heavy drinking. There's also very high rates of physical and sexual assault that are associated with binge drinking. And so it's a big issue on college campuses. The APA, the American Psychological Association, has sponsored a study, or is behind a study, that is now looking at rates of binge drinking on college campuses and starting to do some longitudinal work, following those students who engage in binge drinking during their college years and following them through their 20s now into their 30s to see if that has had a long-term impact, if they continue to engage in that behavior, or if that behavior morphs into or turns into struggle with alcohol later on in life. In terms of the prevalence of alcohol abuse, we do know that there's a higher prevalence in men, and we do know that white and Hispanic adolescents and adults are more likely to binge drink than African American or Asian Americans. Alcohol dependence is highest among Native Americans and Hispanic. And we, as I mentioned before, we do see a fairly high level of comorbidity with other disorders. We see comorbidity in terms of other addictions like cigarettes or drugs, but also with other psychological disorders such as personality disorders, mood disorders, schizophrenia. These two disorders, alcohol abuse and other mental health issues, are happening at the same time. It doesn't necessarily mean that one is causing the other. Sometimes what we find is that when an individual is struggling with a mental health issue, they will turn to drugs or alcohol as a coping mechanism, and that in turn morphs into substance abuse. What are some of the short-term effects of alcohol? When you have a drink of alcohol, it goes from the stomach into the small intestine. Through the small intestine, it's going to enter the bloodstream, and it's going to do so pretty quickly. The bloodstream is going to take that alcohol into the liver, and the liver is going to very slowly metabolize 1 ounce of 100 proof alcohol per hour. The short-term effects of alcohol vary a lot. They vary a lot by concentration, how strong the drink is. Other variables include things like gender, height, weight, how efficient your liver is, have you eaten, is there any food in your stomach. All those things can impact how quickly the alcohol gets into your bloodstream. When we think about alcohol in terms of amount, the size of a drink is defined by its alcohol content. So In terms of equivalent, a 12-ounce glass of beer is equivalent to a 5-ounce glass of wine, which is equivalent to 1.5 ounces of hard liquor. All of these three are equal in alcohol content. So what are some of the other short-term effects of alcohol? We know that it interacts with several neural systems. It seems to stimulate the GABA receptors. This is what makes people relaxed. It reduces tension. One way to think about it, GABA gets released when you go to sleep. That's what helps you to relax. It increases dopamine and serotonin. That may be why people say that it produces pleasurable effects. And it inhibits glutamate receptors. So this might be what's producing those cognitive difficulties, the slow thinking, the memory loss, slow reaction time, and so on. The impact of ingesting large amounts of alcohol includes significant motor impairment, poor decision making, and poor awareness of errors made. One thing to consider is that ingesting alcohol is similar to taking a Xanax. It has this sort of similar kind of relaxing, making you feel sleepy sort of impact. Here we've got a blood alcohol concentration calculator. Again, this is pretty rough because, as I mentioned before, people do metabolize things differently depending on how much you eat and so on and so forth. But it gives us sort of a good idea of how much alcohol you've consumed, if you're a man or a woman, and your weight, what your blood alcohol level is going to be. What's very interesting when we think about this, a very super study was done that looked at the impact of alcohol on the brain and behavior. It utilized an MRI scanner, and it had participants perform simulated driving tests. And what was interesting is that obviously the higher doses of alcohol impaired driving, which was expected. Everyone expected that drinking was going to, the more you drank, the more your motor abilities were going to be impaired. But what was unexpected was the person's ability to make decisions about their impaired driving. So in other words, the more inebriated a person became, the more likely they were unable to judge their ability to drive and to make a sound judgment about handing the keys off to someone else or calling a cab or so on. So what are some long-term effects of alcohol? Two of the main things I want to discuss on this slide is that when an individual engages in long-term use of alcohol and they are considered alcoholic, is that it impacts their ability to digest properly, and they become malnourished. The alcohol interferes with the absorption of vitamins from food, and we see a lot of deficiency of B-complex vitamins, and it's called amnesic syndrome. And this syndrome is connected with loss of memory for both long and short-term information. Basically, alcohol itself is not a nutrient. It's not a nutrient-rich substance. It's basically nutrient deficient, but it's highly caloric, and as time goes on, the individual drinks rather than eats, and so their bodies just simply don't absorb the vitamins and the minerals that they need in order to maintain health. And that starts a deterioration process. What people often notice with heavy drinkers or alcoholics is that at first they're chubby, they're heavy because of the high calories that are connected with alcohol. But as they get older, what happens is they become actually quite skinny. Their legs and arms become very thin, and their bellies become distended because they're actually malnourished. The other major thing I want to talk about in terms of a long-term effect of alcohol is cirrhosis of the liver. As time goes on, the liver continues to filter out this alcohol and filter out this alcohol. Liver cells, they become engorged with fat and protein, and then ultimately all that impedes the functioning of the liver. The liver actually gets larger and larger. The cells die, it triggers scar tissue, that obstructs blood flow, and ultimately the liver stops functioning. Liver disease and cirrhosis rank as the 12th in terms of causes of death in the United States. It's a true health issue. Other long-term effects of alcohol include damage to endocrine glands in the pancreas, heart failure, erectile dysfunction, the inability to get an erection or maintain an erection due to drinking too much, hypertension, stroke, capillary hemorrhages, and also the destruction of brain cells. Now, in the media, we do hear about some positive effects of alcohol consumption. This is called the French paradox. Some people call it the French paradox, which is how do these French people who are eating lots of cream and butter and cheese yet have a lower rate for heart disease? And the answer may be in the red wine that they consume. That the red wine lowers LDL, which is your bad cholesterol, and raises the HDL, which is your good cholesterol. In addition, red wine has a tendency to have that psychologically calming effect that we've talked about, and which causes them to de-stress and not have that same level of tension. But I want to be really clear here. That health benefit, we find that health benefit only in moderate drinking. And when I say moderate drinking, I'm really talking about 5 ounces, that's a small glass of red wine a night. Not heavy drinking, not excessive drinking. I'm going to go ahead and close out our conversation on alcohol dependence by talking a little bit about fetal alcohol syndrome. And fetal alcohol syndrome is caused by heavy alcohol intake during pregnancy. It is one of the leading causes of mental retardation in this country. Basically what happens is that if a woman drinks during pregnancy, fetal growth is slowed, and we see a lot of cranial, facial, and limb anomalies that can happen due to drinking that go along with lowered IQ. Really what is recommended for women is total abstinence. That is the recommendation that is made by any sensible OB/GYN will tell any expectant mother no drinking is a safe amount. Better err on the side of caution. It's a short amount of time. It's only 9 months. It's 40 weeks. Better to abstain than to take a risk.